Good afternoon, everyone. Bonjour tout le monde.
Good afternoon, everyone.
So, Ontario's public home care agency, Ontario Health at Home, became the target of a cybersecurity incident that compromised the patient health information for at least 200,000 home care patients. Now, in the modern digital world that we unfortunately exist in, it is a sad reality that cybersecurity incidents do occur. The occurrence itself isn't necessarily the news. It's the fact that after the incident occurred, the government took no action for 3.5 months until my publicly disclosure forced them to begin notifying patients. Until now, the specific details of the cybersecurity incident were unknown, but new findings revealed that the personal health information was encrypted by malicious parties who refused to restore access until a ransom was paid. The sinister motive of these criminals now indicates a heightened risk to home care patients and reveals a previously concealed element of criminality, which the Premier and Minister of Health have failed in their duty to disclose. Put another way, our province was targeted for extortion by criminals in an operation that can only be described as a shakedown. The Premier failed to respond as the law requires and has consistently deceived the public ever since by failing to reveal details until he has been forced to do so. And that's the part that is so disconcerting in all of this. We still don't understand how bad the attack was and whether even the threat has been mitigated. All we do know, and that is through no thanks to any disclosure from this government, all we do know is that at some point, patient health information for at least 200,000 home care patients was encrypted, and then suddenly it became decrypted, suggesting that a ransom might have actually been paid. And that is alarming, both from the perspective of accountability for taxpayer dollars, but also because the payment of ransom under the Criminal Code of Canada can be illegal under specific circumstances. The Premier and his Minister of Health have consistently failed to warn the public about the risk that exists to their personal health information, and at every stage have failed to inform patients about the severity of this incident. And that is why this afternoon I'm asking Doug Ford 3 questions. How much was the ransom? Was the ransom paid? And when did the Premier and Minister of Health find out about this? You know, Doug Ford has spent millions of taxpayer dollars proclaiming all of the ways in which he says he will protect Ontario, but has almost nothing to actually show for it. Well, today the cat is out of the bag, and we're seeing what it actually looks like when the Premier has a chance to protect Ontario. Let's be clear. Our province was shaken down and extorted by malicious parties, and his response was to say nothing, do nothing, and possibly even allow millions of taxpayer dollars to fall into criminal hands.